If by evening your leg shows sock marks, your shoes suddenly feel tight, and you reassure yourself by saying, "It's just age, nothing to worry about," it is precisely at this moment that you might miss a signal the body has been sending for some time. The biggest mistake I see again and again is not that people experience swelling. The mistake is that for years they consider it a normal occurrence. But the body does not create excess fluid just because. It is always trying to say something. And the sooner you understand this language, the better your chances of maintaining your health, activity, and usual life without serious consequences. I want you to listen to this entire conversation until the very end today. At the very conclusion, I will discuss a point that surprises even many people who have dealt with swelling for a long time. This nuance is rarely explained during standard appointments, although it is often what helps identify the true cause of the problem. Believe my many years of experience, many people start looking at their own health in a completely different way after this. With age, we become more attentive to our bodies. That is correct. But sometimes this attention comes too late. Many get used to the fact that their legs look almost normal in the morning but become heavy by evening. Some notice it becomes harder to walk for long periods. Some start choosing shoes a size larger. Some stop enjoying walks because their legs feel like they are filled with lead. And gradually a person rebuilds their life around the problem instead of figuring out why the problem appeared in the first place. I always tell my patients one simple thing: a symptom does not arrive without a reason. The body is organized in an amazingly rational way. If fluid is being retained somewhere, it means the balance has been disrupted. Sometimes this is a minor disruption that can be corrected in time. Sometimes it is the first warning of an illness that has not yet managed to fully manifest itself. That is exactly why you cannot treat swelling as something inevitable. Remember how your day used to go. Many could easily walk for hours, work in the garden, or climb stairs without thinking about every step. Today, some start looking for the nearest bench after only a few minutes of walking. Of course, age changes the body, but age itself should not necessarily bring constant swelling. It is very important to understand this. In decades of practice, I have seen thousands of patients. Many came with complaints only about their legs. They would say their heart was fine, their blood pressure was more or less normal, and their lab results were once decent, but it was the conversation about swelling that started an examination, which allowed us to detect the problem in time. And conversely, there were people who did nothing for years because neighbors told them everyone is like that. After 60, unfortunately, later on, the treatment became much more complicated. There is one more peculiarity. Our body is able to compensate for imbalances for a long time. It works patiently, adapts, and looks for workarounds. That is why a person may feel quite normal until their margin of safety runs out. That is when symptoms begin to grow rapidly. That is precisely why it is important to pay attention even to changes that seem minor. I want to ask you a simple question. When was the last time you took a close look at your legs, not just in the morning, but in the evening? Have you noticed whether a mark remains after pressing with your finger? Has your usual footwear become tighter? Does a feeling of heaviness appear without any serious exertion? Sometimes honest answers to these questions give a doctor more information than a long story. It is very important to understand one more thing. There is no single cause for swelling. That is exactly why advice from acquaintances often does not work. One person starts drinking less water, another buys diuretics, and a third looks for miracle ointments, that the real cause remains unattended. Moreover, some such actions can even worsen the situation. For example, uncontrolled use of diuretics can disrupt the balance of essential minerals in the body, which affects heart, muscle, and nervous system function. Today, we will gradually sort out why legs begin to swell more often, specifically after 50 years of age, which 3 causes occur especially frequently, and how to distinguish relatively safe changes from dangerous signals, and what simple habits help the body work significantly better. All of this is connected much more strongly than it seems at first glance. If such calm and clear explanations help you better understand your health, support this conversation, like the video, and subscribe to the channel. This helps more older people receive important information on time and not be left alone with their questions. And now it is time to take a close look at the first and most common cause, which many have mistaken for simple fatigue for years, although it is often the start of a long chain of changes throughout the entire body. Very often, a person is certain that their legs are just tired. The day was long, and they had to stand a lot. They went to the store, worked in the garden, or went for a walk with their grandchildren. It seems quite logical that heaviness appeared in the evening and the ankles became a little wider. The next morning, the swelling decreased and the anxiety disappeared. But this is exactly where many people make a mistake. If such a pattern repeats regularly, the body stops whispering. It begins to insistently warn that one of its systems is working under overload. In most cases, the first cause is a disruption in venous function. It is through the veins that blood must rise from the bottom up from the feet to the heart. At a young age, this is aided by elastic vessels, well-functioning valves inside the veins, and active calf muscles. Every step becomes a kind of helper for blood circulation. The muscles contract, squeeze the vessels, and literally push the blood upward. With age, this mechanism begins to work less efficiently. The vessel walls gradually lose their elasticity. The venous valves no longer close as tightly as they used to. If a person sits a lot, or conversely stands for a long time without moving, blood begins to pool in the lower limbs and the pressure inside the veins increases. Through the vessel walls, fluid gradually leaks into the surrounding tissues. That is how evening swelling appears. That is precisely why many notice that their legs look almost normal in the morning, but become heavy toward the evening. This is a very characteristic feature of venous edema. At night, when the legs are practically at the same level as the heart, some of the fluid manages to return to the bloodstream. During the day, gravity starts acting again, and the problem gradually repeats itself. Scientific studies in recent years confirm that chronic venous insufficiency becomes significantly more common after the age of 50. This is not only related to age. Excess weight, lack of physical activity, years of standing or sitting at work, past pregnancies in women, and hereditary predisposition all play a major role. All these factors gradually stack up like small bricks, changing the way the vascular system works over the years. Sometimes a person says, "I don't have varicose veins, so the cause is definitely not the vessels." This is a common misconception. Visible dilated veins do often accompany the disease, but they do not always appear immediately. It happens that valves are already working poorly and blood stagnation is already present, but the person does not yet see pronounced external changes. That is precisely why you cannot rely solely on the appearance of your legs. There is another important point. Many try to drink less water, hoping to reduce swelling. At first glance, it seems logical. If less fluid is consumed, then swelling should become less too. In practice, the body often reacts quite differently. When there is not enough water, blood becomes more viscous, it is harder for vessels to do their job, and the body begins to retain fluid even more actively. As a result, a person not only fails to get rid of the problem, but sometimes makes it more pronounced. Of course, there are diseases where fluid intake really must be controlled by a doctor. But for most people, drastic self-imposed restriction of water is not the right solution. It is much more useful to maintain a normal drinking regimen while simultaneously improving vessel function through natural methods. I always advise paying attention to one simple habit. If you have to sit for a long time, don't wait for the movie or TV show to end. Every 45 or 60 minutes, stand up for at least 2 or 3 minutes. Walk around the room. Slowly rise onto your toes and lower onto your heels several times. It seems too simple to be useful, but such movements reactivate the calf muscle pump, which helps veins return blood upward. Studies show that even short periods of movement throughout the day significantly improve venous blood flow compared to long, continuous sitting. The body does not require complex workouts. It needs regular signals to move. Another useful observation concerns evening rest. Many sit in a chair, stretch their legs forward, and think that is enough. Actually, the best effect is achieved when the lower legs are positioned slightly above the level of the heart. Even 15 or 20 minutes in this position helps some fluid leave the tissues and return to the bloodstream. Of course, this doesn't treat the cause, but it is a good way to reduce the daily load on your legs. Sometimes patients ask if they should buy compression stockings right away. The answer is not always the same. Compression garments truly help many people with venous insufficiency. They create the right pressure distribution, facilitate blood return to the heart, and reduce swelling severity. However, it is very important to choose the right level of compression. Too weak might prove useless, while too strong is sometimes contraindicated for certain arterial diseases. Therefore, these products are best chosen after consulting a specialist rather than by the advice of neighbors or ads. Over my years of work, I have noticed an interesting pattern. Patients who start moving regularly, control their body weight, do not overconsume salt, and pay close attention to early symptoms, face severe complications of venous disease much less often. They maintain the ability to walk freely, travel, and engage in their favorite activities for longer. And that is exactly what determines the quality of life in old age. But the work of the veins is only one part of a bigger picture. Sometimes vessels perform their task as well as circumstances allow, but fluid still continues to linger in the tissues. In that case, the cause turns out to be much deeper. It is linked to the organ that works without rest for a lifetime, ensuring the movement of blood throughout the body every minute. This is where many first understand why one cannot evaluate edema solely by the state of the legs. When a person first hears that the heart could be the cause of swelling, many start to worry immediately. Some get scared too early, while others, conversely, reassure themselves, quote, "If there were something serious with my heart, I would have felt it long ago." In reality, the truth lies somewhere in the middle. The heart can indeed work under increased load for years without causing intense pain. This is precisely why the first signals are often not at all what most people imagine them to be. The heart works without stopping every second of our lives. As you listen to these words, it continues to contract dozens of times per minute, sending blood to every organ and every cell. If its pumping function begins to gradually decline, blood moves more slowly. The body can no longer efficiently return fluid back into the bloodstream. It starts to linger in the tissues. Very often, it is the legs that show this first. There is a specific feature that is important for every person over 50 to know. Cardiac edema rarely appears suddenly. It develops much more gradually. First, a person notices slight heaviness at the end of the day. Then shoes become tighter. After some time, there is a feeling that climbing stairs has become more difficult. Then a slight shortness of breath arises during usual exertion. Many explain this by age, weather, or extra pounds, but the body is already putting all these signs together into a single picture. Modern cardiology has long proven that heart failure does not always begin after a severe heart attack. It can develop slowly against the backdrop of long-term high blood pressure, diabetes, heart rhythm disorders, valve diseases, and even years of untreated conditions. That is precisely why regular blood pressure monitoring remains one of the most important habits for an adult. I often hear the same phrase, "My blood pressure sometimes goes up, but I don't feel it." That is exactly where the danger lies. High blood pressure does not always cause a headache or make you feel unwell. It gradually forces the heart to work with greater force. Imagine a pump that is forced to pump water through a pipe that is too narrow for years. At first it manages, then it begins to work under an overload. Over time, its capabilities diminish. Roughly the same thing happens to the heart muscle. Studies show that controlling blood pressure significantly reduces the risk of developing heart failure. And this is not just about medication. Lifestyle plays a huge role. Moderate physical activity, quitting smoking, reducing excess salt, and maintaining a healthy weight help the heart do its job significantly more efficiently. Pay attention to one more important sign. If your face looks a bit puffy in the morning and your legs swell more in the evening, especially both at the same time, this is a reason not to delay an examination. Of course, such changes can be linked to other causes, but a combination of several symptoms always requires medical attention. There is a simple question that I ask almost every patient. Has it become harder for you to perform your usual tasks compared to last year? Not compared to your youth, but specifically compared to last year. Many think about it for the first time only after this question, because the changes happen gradually. The body gets used to them, and a person imperceptibly begins to limit themselves. They walk less, climb stairs less often, use the elevator more frequently, and rest longer after a normal walk. It seems that life remains the same, but in reality its boundaries are becoming narrower. It is very important to understand that heart disease today does not always mean losing your usual way of life. Modern medicine has effective treatment methods, but they work much better when the problem is detected in time. The sooner a person pays attention to the first signals, the more opportunities there are to maintain good health for many years. Sometimes patients admit that they were afraid to go to the doctor precisely because they didn't want to hear an unpleasant diagnosis. I always answer the same way. A disease does not become smaller just because we stop thinking about it. However, a timely examination often allows us to stop its development at the stage when a person has not yet lost their quality of life. There is one more habit that seems completely harmless, but over time, it can significantly increase the load on the heart. It is the excessive consumption of salt. Many people do not even notice how much salt they consume daily. It is contained in more than just the salt shaker on the table. Sausages, cheeses, ready-made sauces, canned goods, convenience foods, smoked meats. Even some types of bread can contain large amounts of sodium, and sodium retains water in the body. The more fluid that has to be retained, the greater the strain on the blood vessels and the heart. The World Health Organization recommends that adults consume no more than 5 grams of salt per day. In practice, many get almost twice as much. Even a small reduction in salt intake can help some people notice less swelling and more stable blood pressure after just a few weeks. This does not mean giving up flavor entirely. It means being more attentive to what ends up on your plate every day. There is another simple habit that is worth trying tomorrow. If you measure your blood pressure regularly, don't limit yourself to just one number. Write down the readings in a small notebook or on your phone. In a month, you will see a picture that is impossible to notice from individual measurements. It is these records that often help a doctor understand more quickly what is happening with the cardiovascular system. If this discussion helps you look at familiar symptoms in a new way, support the channel, leave a like, and subscribe. Perhaps thanks to this video, one of your loved ones will pay attention in time to changes they previously thought were just fatigue. But even if the heart is working well and the state of the veins does not explain the significant swelling, there remains one more reason that is talked about much less often. It often comes as a surprise to people who were sure that the problem was only with their legs, while in reality, the source is in a completely different part of the body. Very often, after an examination, a person learns with relief that the heart is working satisfactorily and no serious vein disorders have been found. And the thought arises, so I can calm down. But it is precisely at this moment that I ask you not to jump to conclusions. The body is designed much more complexly. Sometimes the cause of fluid retention is not where we feel it. The legs swell, but the problem develops in organs that many do not even associate with such symptoms. We are talking about the kidneys. They are the ones performing one of the most complex tasks in the body around the clock. A huge amount of blood passes through them every day. They filter it, remove waste products, maintain the correct amount of fluid, and regulate the levels of sodium, potassium, and other substances essential for normal muscle contraction and the function of the nervous system and heart. As long as the kidneys are doing their job, a person doesn't even think about their existence. But when their capacity begins to decline, the body very quickly loses its familiar balance. The problem is that kidney diseases can go unnoticed for a long time. That is their unique characteristic. They rarely begin with severe pain. Much more often, the changes happen gradually. A person feels almost the same as before. Sometimes there is slight weakness, sometimes blood pressure rises, sometimes the legs or face begin to swell. Many don't link these signs together because each of them seems insignificant. There is one symptom that deserves special attention. If you notice noticeable swelling around your eyes in the morning, especially if it didn't happen before, you shouldn't delay a checkup. Of course, a sleepless night or a salty dinner could be the cause, but if this pattern repeats regularly, you must check your kidney function. They might be warning you that they are overloaded in exactly this way. Modern nephrology shows a very important pattern. After the age of 50, the rate of blood filtration by the kidneys gradually decreases, even in a healthy person. This is a natural part of aging. But if diabetes, high blood pressure, smoking, or the long-term use of certain medications without medical supervision are added to age-related changes, this process can go much faster. People with diabetes should be especially attentive to their health. High sugar levels damage the tiny vessels inside the kidneys over the years. At first, a person notices nothing, then the kidney's ability to filter blood gradually decreases. That is why it is so important for people with diabetes to get regular tests, even if they still feel fine. I always explain one simple thought to my patients. Feeling good does not always mean the absence of disease. Conversely, an abnormality detected in tests in time does not yet mean a severe illness. It means the opportunity to start acting while the situation is still under control. There is one more mistake that people make very often. They start taking various diuretics on their own because it seems that this is the fastest way to get rid of excess fluid. Sometimes this really reduces the swelling temporarily, but the underlying cause does not disappear. Moreover, the uncontrolled use of such drugs can lead to dehydration, electrolyte imbalances, impaired kidney function, and even dangerous heart rhythm problems. Over my years of practice, I have often seen patients who took diuretics for months on the advice of acquaintances. They sincerely believed that they were helping themselves. In reality, their body was gradually losing essential minerals, and the real cause of the disease continued to progress. That is why any such treatment should only be prescribed after a medical examination. It is also very important to keep in mind other medications a person may be taking for other reasons. Some painkillers, when used long-term and without control, can impair blood flow to the kidneys. This does not mean that they cannot be used at all. This means that all medications require a responsible approach. If pain becomes constant and you have to take pills regularly, it is much better to find the cause with a doctor than to just treat the symptoms for months. Another scientific fact that is rarely discussed: the kidneys are very sensitive to the state of the blood vessels. If the vessels suffer from high blood pressure, smoking, high cholesterol, or diabetes, the kidneys begin to experience a lack of proper blood supply. Therefore, taking care of your blood vessels simultaneously means taking care of your kidneys. Everything in the body is interconnected much more strongly than it seems at first glance. Try to pay attention over the next 7 days not only to swelling but also to your daily routine. Are you drinking enough plain water throughout the day? Do you replace water with sugary drinks or large amounts of strong tea and coffee? Do you put off going to the restroom for long periods? Each of these habits seems minor, but it is precisely these little things that make up the daily work of the kidneys. There is another indicator that cannot be ignored. If your blood pressure has been rising more often for no apparent reason, it may not just be heart-related. Sometimes the kidneys are the first to influence changes in blood pressure. It creates a kind of vicious circle. High blood pressure damages the kidneys, and worsening kidney function further sustains high pressure. You can only break this cycle when the problem is detected in time. Modern medicine has simple blood and urine tests that can assess kidney function before any obvious symptoms appear. Many are surprised by how much information a doctor gains from these studies. That is why annual preventative checkups after age 50 should not be considered a mere formality. Very often they allow for the detection of changes while a person still feels practically healthy. But even the heart, veins, and kidneys do not explain absolutely all cases of swelling. There is one more reason that develops slowly, almost imperceptibly, and is closely tied to our lifestyle. It largely determines how easily the body manages fluid retention every day, even if there are no serious diseases yet. When serious diseases are ruled out, many sigh with relief and say, so it's nothing to worry about. It is here that it is important to make one correction. The absence of a serious illness does not mean that the body is working perfectly. Very often legs start to swell because habits that seemed harmless for years are gradually changing the work of blood vessels, muscles, and the lymphatic system. These changes happen slowly. That is precisely why a person rarely notices when it all began. We are used to talking about blood circulation, but we rarely remember the lymphatic system. Yet it is the one that helps return excess fluid back into the bloodstream every day. If you imagine the body as a big city, then blood vessels deliver everything necessary and the lymphatic system is responsible for waste removal. It collects excess fluid and metabolic products and supports the immune system's work. As long as this mechanism works smoothly, tissues do not accumulate excess water. But if lymph flow slows down, fluid starts to be retained. There is one feature that is important to understand. The lymphatic system does not have its own powerful pump like the heart does. It depends largely on human movement. Every step, every contraction of the calf, thigh, and foot muscles helps the lymph move along. That is why prolonged inactivity is one of the most underestimated causes of swelling. Today, many people spend most of the day sitting. Some work at a computer, some watch television for hours, some enjoy reading, knitting, or engaging in other quiet activities. All of this is not dangerous in itself. A lack of regular movement is dangerous. After a few hours of inactivity, muscles essentially stop assisting blood vessels and lymphatic pathways. Fluid gradually begins to accumulate in the tissues. Scientific studies show that even after an hour of continuous sitting, blood flow velocity in the veins of the lower limbs noticeably decreases. If this situation repeats daily, the body gradually begins to perceive it as the new normal. That is precisely when many first notice heaviness in their legs by evening. Sometimes patients are surprised when I ask not about medications, but about the number of steps they take per day. At first glance, it seems that this does not matter much. In reality, regular walking remains one of the most effective ways to maintain the normal function of the vascular and lymphatic systems. We are not talking about athletic records. After 50 or 60, the body most often does not need exhausting workouts. It needs consistent, moderate physical activity. Even a calm walk at a comfortable pace brings significantly more benefit than infrequent, heavy physical exertion. Try conducting a small experiment. For 7 days, walk for at least 30 minutes every day. If it is difficult to cover this distance at once, split the walk into 2 or 3 parts. The main condition is not speed, but regularity. Very many people notice after just a week that their legs feel lighter. By evening, they have more energy, and their sleep becomes sounder. There is one more factor that increases the tendency for swelling, and it is rarely discussed seriously enough. It is excess weight. Every extra kilogram increases the load on the vessels of the lower limbs. It becomes harder for veins to pump blood back up. Joints work under greater strain. You want to move less, and a vicious cycle emerges. The less movement, the greater the fluid stagnation. The more severe the swelling and heaviness, the less the desire to move. It is very important not to blame yourself for this. Many mature people sincerely try to change their lifestyle, but they take overly drastic steps. They start strict diets, heavy workouts, and completely change their usual eating habits. After a few weeks, the body tires of this regimen, and the person returns to their old lifestyle. Practice shows something completely different. Small but consistent changes work much better. If you walk just a little more each day than you did yesterday, if you gradually reduce the amount of sweets and processed foods and add more vegetables, fish, and whole grains, the body begins to respond gradually but very steadily. There is another habit that seems insignificant. Many people come home in the evening and immediately put on soft slippers without a back, virtually stopping their feet from moving correctly. Of course, the footwear itself does not cause the disease, but comfortable shoes with good arch support during walks help muscles work more efficiently, which means the natural muscle pump, which facilitates blood and lymph drainage, also works better. I want to say something more about salt from another perspective. We have already discussed its effect on the heart, but excess salt also increases fluid retention in tissues, even in people without clear heart disease. The body tries to maintain the correct concentration of sodium in the blood, so it retains more water. That is why, after eating very salty food, some people notice facial puffiness in the morning and feel heaviness in their legs by evening. Interestingly, taste buds adapt to a lower amount of salt quite quickly. Usually this takes a few weeks. After that, food that used to be familiar starts to seem too salty. The body is capable of adapting much better than many people think. I also advise paying attention to your evening meal. A very heavy dinner right before sleep puts an additional load on the metabolism. If it is also rich in salt, the likelihood of morning puffiness becomes higher. It is much wiser to finish your main meal a few hours before sleep and choose lighter dishes. Another detail that is often underestimated: the quality of sleep and the tendency towards swelling. Lack of sleep is accompanied by changes in hormonal balance, intensifies inflammatory processes, and affects blood pressure and fluid exchange. A person may not notice this connection, but the body feels it very well. Over many years, I have become convinced of one pattern. People who pay attention to simple habits every day maintain ease of movement more often than those who rely only on pills. Medication is necessary when it is truly needed, but no drug can completely replace movement, sensible nutrition, and a mindful attitude toward your own body. And yet, there is one more question that is asked at almost every appointment. Many people want to understand how to distinguish a situation where you can calmly schedule a routine checkup from a moment when you can no longer wait. These signs often save health and sometimes even lives. There is one mistake that people make more often than you might imagine. They wait for severe pain. It seems that if nothing is truly hurting, then the situation can wait. But the body does not always warn us with pain. Sometimes it acts much more quietly. It gradually changes your usual well-being, makes you get tired faster, reduces endurance, and causes slight swelling that appears only in the evening at first. That is why many dangerous diseases develop unnoticed. I want you to remember a simple thought. Not every swelling means a serious illness, but every recurring swelling deserves attention. If the problem arises again and again, the body is already showing that it cannot fully cope on its own. It is especially important to pay attention to the speed at which symptoms appear. If your legs started to swell gradually over several months, that is one situation. If, however, noticeable swelling appeared in a short time, especially if it is accompanied by shortness of breath, chest pain, severe weakness, or a sudden deterioration in health, you cannot delay seeking medical help. Such changes require urgent evaluation by a doctor. There is one more sign that cannot be left without attention. If one leg suddenly becomes significantly larger than the other, accompanied by pain, redness, or heat, this is not a time to wait a few days, hoping it will pass on its own. Sometimes this picture can be related to a disruption of blood flow in the deep veins. Such a condition requires immediate medical evaluation. Unfortunately, many people first try to seek advice online, ask their neighbors, or start taking various medications on their own. I understand the desire to manage things yourself, but there are situations where lost time becomes the most dangerous factor. It is very important to monitor changes not just for a day, but over a period of time. That is exactly why I advise patients to keep a small observation diary. It is not difficult. It is enough to record when the swelling appears, whether it decreases after a night's rest, and if it is accompanied by shortness of breath, blood pressure changes, weight gain, or other symptoms. By the way, speaking of body weight, many are surprised when I ask them to weigh themselves regularly. It might seem, what does weight have to do with swelling? In reality, quite a lot. If your body weight has unexpectedly increased by 1, 2, or even 3 kilograms in a few days without changing your diet, the cause could be fluid retention. Fat tissue does not appear that quickly, but water can be retained in the body in a very short time. Another important signal is related to urination. If you notice a marked decrease in urine output, especially if it coincides with increasing swelling, it requires a doctor's consultation. The kidneys and the circulatory system are closely linked, so such changes should never be ignored. Very often people ask what tests they should undergo if swelling appears regularly. In most cases, a doctor starts with the essentials. Blood pressure is measured, the condition of the vessels is assessed, and blood and urine tests are ordered. If necessary, an electrocardiogram or an ultrasound of the heart, vessels, or kidneys is performed. These examinations allow for a fairly complete picture and help determine the direction to take next. Sometimes patients fear medical examinations even more than the disease itself. In reality, modern diagnostic methods are painless in most cases and take very little time. However, the information obtained helps to avoid much more serious problems in the future. There is another common mistake. Some people start using various heating procedures, hot foot baths, or intensive massage without identifying the cause of the swelling. In some cases, this may indeed temporarily improve how you feel, but with certain vascular or heart conditions, such procedures can actually make the state worse. That is why it is necessary to understand the source of the problem first and only then choose a method of treatment. I also want to say a few words about folk remedies. Over many decades, a huge number of recipes and concoctions, infusions, and home remedies for reducing swelling have accumulated. Some plants do indeed have a mild diuretic effect, but natural origin does not mean complete safety. Herbs also affect the function of the kidneys, heart, and electrolyte levels and can interact with medications a person is already taking. Therefore, any such remedies must be discussed with your doctor. There is one more point that is often left unnoticed. After age 50, many people begin taking several medications at once. Sometimes it is the combination of some of them that can increase the tendency for fluid retention. This does not mean the medications are bad or that you should stop taking them on your own. On the contrary, stopping can be dangerous. But you must inform your doctor about all drugs you take, including vitamins, supplements, and herbal remedies. Sometimes this information helps find an explanation for what is happening much faster. Try to conduct a small but very useful experiment over the next week. Each evening, take 2 minutes to calmly assess how you feel. Look at your legs and recall how active your day was. Check your blood pressure if you do so regularly, and answer a simple question. Was today better, worse, or the same as yesterday? Such calm analysis gradually teaches you to understand your own body much better. Over years of practice, I have learned that people who notice small changes more often seek help in time. They do not wait for the moment when the illness becomes obvious. That is why their treatment usually goes more smoothly and yields better results. And the most important conversation remains. We have discussed the heart, blood vessels, kidneys, and the impact of movement, diet, and habits. But there is a principle that unites all these causes. It is what helps many people not just reduce swelling, but change their attitude toward their health so the body stops constantly sending distress signals. There is one thought I want to leave you with after our entire conversation. Leg swelling almost never becomes the main problem on its own. It becomes a message, a calm, persistent, repeating message from the body that it is time to pay attention to yourself. And that is exactly the important point I promised to talk about at the beginning. The biggest mistake is not that a person encounters swelling. The biggest mistake is trying to fight only the fluid rather than the cause of its appearance. Many spend years looking for ointments, buying new diuretics, using compresses, and restricting water, hoping to get rid of the symptom. But the body does not stop sending the signal until what is causing the signal is resolved. See how everything turned out to be interconnected. If veins work poorly, fluid begins to be retained in the tissues. If the heart finds it harder to pump blood, the body also responds with swelling. If the kidneys are no longer fully coping with their task, excess fluid remains in the body again. If a person moves little, eats poorly, consumes too much salt, and gradually gains weight, the body's natural fluid removal mechanisms also start working less effectively. At first glance, these are completely different causes, but they are united by one thing. They all develop gradually, not in a day and not in a week. That is exactly why everyone has precious time when the situation can still be changed. I often remember patients who came back a year after their first consultation. Many of them told the same story. They didn't do anything heroic, didn't start living by strict rules, and didn't spend hours at the gym. They simply started following a few simple recommendations every day. They started walking more, stopped mindlessly adding salt to their food, started checking their blood pressure, and followed their doctor's orders. They didn't stop treatment after the first signs of improvement and kept track of their test results. And a few months later, they would say one important phrase: I feel lightness in my legs again. That is exactly how real results are achieved. They don't come from a single miracle cure, but from a system of small, correct actions that become part of daily life. Modern science fully confirms this approach. Studies show that controlling blood pressure, moderate physical activity, maintaining a healthy weight, quitting smoking, sensible eating, and timely treatment of chronic diseases significantly reduce the risk of cardiovascular complications. They slow down the decline in kidney function and help maintain a good quality of life in old age. There is no secret here, only consistency. It is very important to get rid of one more misconception. Some believe it is already too late to take care of their health. I have heard these words dozens of times. I'm already 65. I'm already 70. What is there to change now? But the human body is surprisingly grateful. Even in old age, it is capable of responding positively to the right changes. If a person starts moving more, the calf muscle pump starts working better within just a few weeks. If you reduce salt intake, it becomes easier for the body to maintain its water balance. If blood pressure is normalized, the strain on the heart and blood vessels is reduced. If kidney disease is detected on time, there is an opportunity to slow its progression for many years. Sometimes the most important changes are impossible to see right away. They happen inside the body. Blood vessels work more smoothly, the heart exerts less effort, and the kidneys perform their tasks better. And a person notices only one thing: life feels easier. They can walk their usual route again without heavy legs. They stop looking for a place to sit down every 10 minutes. They enjoy walks, trips, and spending time with their family again. I want you to remember not the fear of swelling after this talk, but respect for your own body. It rarely makes mistakes. If symptoms recur, it means it is time to look into them, not get used to them. Do not put off an examination just because the pain is not yet severe. Do not prescribe treatment to yourself. Do not believe that aging must bring constant heaviness in your legs. So much depends on how carefully you treat yourself today. Start with the simplest things. For the next 7 days, observe your feet every morning and evening. Monitor your blood pressure if it has been elevated in the past. Try to find time for a calm walk every day. Do not consume too much salt. If swelling occurs regularly or gets worse, be sure to see a doctor and get a checkup. These simple steps can be far more important than any random advice. Thank you for following this journey with me until the very end. If this talk helped you understand your body's signals better, please like and subscribe to the channel. Perhaps one of your loved ones who considers swelling just a part of aging will see this video, even though their body is asking for help. Share this video with your family and friends. Sometimes a few minutes of an attentive talk about health can change much more than it seems.